You may have suffered from your problem for many years. You may suffer from other health problems, or you may have had back surgery. Can you still recover in these situations? Of course. The majority of our patients are highly satisfied with their recovery, but there are some variables you should be aware of related to your health that will affect the speed and the satisfaction with your recovery. Your problem and your pains. If you are suffering from several conditions and symptoms, you will recover differently than someone else who suffers from only one condition or symptom. If you have had your problem for 20 years, you will recover differently than someone else who has had it for only 2 years. If your problem extends throughout your body, for example, a low back pain that radiates down your legs, you will recover differently than someone else who only has low back pain. The length of and satisfaction with your recovery depend, in part, on the number of conditions and symptoms that you suffer, the time that your problem has been affecting you, and the reach of your problem on your body. Other health problems. If you suffer from other health problems, for example, gout, tendinitis, poor circulation in your legs, or obesity, you will recover differently than someone else who doesn't. Your recovery depends on other health problems you may be suffering from, even without you knowing it, that may also result in pain, discomfort, or other symptoms, but have nothing to do with the problem we manage in káyros. Past failed treatments. If you have been under prior unsuccessful physical treatments, or you have had back surgery, your problem could have worsened, and your recovery may take longer and not be as complete as expected. Your recovery depends on past failed physical treatments or surgery that may have made your problem worse. Your body. Your recovery also depends on a crucial structure in your body, the spine. Your spine may have been affected by numerous types of injuries during your lifetime. From playing sports, from demanding physical jobs, or from heavy lifting. The most common tests to know about your spine are X-rays and MRI. For example, you could have a spinal deviation, what's called scoliosis. You could have wear and tear of your bones and joints, arthritis, or discopathy. The curvature of your neck could be abnormal. Although abnormal curves can be improved in some patients, these conditions can't be fixed. The goal of recovery in these cases is to improve your problem so you can go back to normal life again as best as possible. Remember, you don't need X-rays or MRI to use káyros, nor referral from another specialist. Your life. Your lifestyle may also affect your recovery. Your age, a physically demanding job, family care, stress, certain medications, exercise, or weather changes can all have an effect. Some of these circumstances are unavoidable, but others are not. To obtain the best possible recovery, you will need to consider your lifestyle. As you have seen, there are some variables which can affect your recovery. And that's not bad news. káyros is realistic about your recovery because we know it won't happen overnight, like the miracle cure that many people hope for. However, our patients tend to be more satisfied with káyros than from years under other treatments, and we would like you to be another of our satisfied patients. Stay with us, and next we'll show you how to become a satisfied patient.